exciting.
But I really appreciate what you're doing, and if I do nothing else tonight, I want to underline and reinforce the meaningful, important work that you're doing. Because I personally feel that you are governing and guiding a cadre of volunteers who are doing holy work on sacred ground, and I mean that from the bottom of my heart. This, I feel, is not just another do-good nonprofit organization. I was passionate about Tamarisk in the beginning because I saw a need for people that are dying that was not being met. And I'm even more passionate about it today because I see and have firsthand the work that the volunteers do in meeting this need with people who are dying and their loved ones. And I would encourage you as board members to listen to those stories from those volunteers. If you want to be enthusiastic about what you're doing here, listen to those stories. It brings me to my knees today still when I listen to them because they make such a contribution in the lives of people that are dying and their loved ones. And I hope that you get as much fulfillment out of this work as I have. I know the day I started volunteering, I became a different person, and I wish that for you as well. As you can tell, 30-some years later, I'm still passionate about this. And I've written down a lot of things because you know, there's a lot of things I want to talk about. A lot of the board members and volunteers never got the history of the organization, or nobody's fault, or it just didn't happen. And I think it's important to really understand how this all evolved so you can gain a better understanding. This organization has a history of 20 years, and there are fundamental, very fundamental, simple principles on which this organization was founded. And I'd like you to know what those are. Probably the one that stands out the most and is the fundamental principle was what I initially called the spirituality of presence. Have you read any of the presence materials that I wrote? I think that's important. I was going to bring some books and papers for you, and I didn't. But I think if you read my original master's thesis was on presence, and it really explains why this is such a central focus for this organization. It was in the beginning, and I hope still is, the core of our training, the real vortex of it. And I listened to you talk about being focused, and that's what that concept of the spirituality of presence has done in the beginning, it does for our training, brings everything into focus. And I'm going to tell you a little bit how this happened, and how I think as I tell the story you can see how that's a reoccurring theme in the founding of the organization, the work of the volunteers. Kathy's, I'm sure, tired of hearing this story. In the early 1980s, my father was diagnosed with terminal lung cancer. I was living in Fridley. My parents lived in Cloquet. I had 3 young children. My parents had no help. It was my mother that was doing it by herself, and I was making casseroles and doing laundry in Fridley to get my husband through 4 or 5 days, and then I would run up north to help my mother care for my father. And I knew they needed more help, and there was nothing available at that time. My father's physical pain was horrendous. And whenever you think we're not making much progress in cancer research, look back at what we've done with pain medication for people. I look back at what that man went through, and it was horrendous. We do better than that today, we know more. But in spite of his physical pain, as badly as that hurt me to watch, even more painful for me was to see his psychological pain, his emotional pain. All of his life, he had been valued for what he could do, and he couldn't do anymore. He felt of no value. He was humiliated by his physical condition. He saw no purpose or meaning in his life anymore. And to this day, I know that that's the piece that resonated with me and was really the the point that I've never forgotten, and it has run through a thread through the whole organization, and I think it's still there today as we talk about presence. I remember yearning for the medical profession, to not look at my father as a disease, to continue to see him as the human being, precious and unique that he always was. I yearned for that. People stopped coming to see him. They didn't know what to say. They didn't know what to do. They didn't know how to just be with someone. And there's that spirituality of presence creeping in again. Pardon me, I want to make sure I'm not missing anything. After my father died, my husband was beginning to put 3 young children through college when I decided I wanted to go back as well. And my profession earlier had been an elementary school teacher, and I always thought I'd always wanted to be a nurse. So I thought, well, maybe I'll try that now, but I didn't know what part of nursing I wanted to go into. So I decided to go up to Unity Hospital and volunteer and try my hand in different parts of nursing and see what resonated with me. And all they had open at that time was a position in the gift shop, which is the last place I wanted to be, was the gift shop. However, she encouraged me to do it because she said, then you'll be on the list to get in when something else opens up and you'll get in quicker. So I did it. And to this day, that was so aptly named the gift shop, because that was a tremendous gift for me. That's where I really saw the need for the concept of presence. Because most of those people that came into that gift shop were not coming necessarily to buy a material gift. They were in that hospital because somebody they knew was hurting, and they were yearning for someone to listen, to really listen to the cries of their heart and what they were not saying. And it spoke to me so vividly, and to this day, the gift shop, it truly was a gift. Because I really realized then how important that is to be present to people 100% emotionally and physically. And while I was volunteering at the gift shop, I noticed in the cafeteria one day a little flyer on the wall offering hospice volunteer training for what is now a line, I think it was Health One at that time. And looking back, I probably didn't have a clue of what hospice really meant, but I knew it had something to do with working with people with dying, and I was really drawn to that. And I couldn't wait to get started. The night of training, I was like a first grader, and I went early, and I sat in the front row because I didn't want to miss anything, and I had my books and I'm all set. And the first thing they did was turn the lights off and show a video of a man suffering from lung cancer. And he had the oxygen. He looked exactly like my father. And I thought, oh my gosh, I can't do this. I made a horrible mistake. And now I'm in the front row, and I'm trying to discreetly get out. And I literally gathered my things. I thought, I can't do this. And I started to get up, and to this day, I can feel it was like a pressure on my shoulders. Somebody just saying, sit down. This is where you need to be. You belong here. It's going to be okay. And that was the end of my trepidation about doing hospice work. I finished the evening, I finished the class, and I've never stopped volunteering since then. I really personally feel that that's when God put his hand on my shoulder and I said yes. And that was, I think, the beginning of the journey for me. As I said, I've never, ever stopped volunteering. I don't think anybody values the work of a volunteer more than I do. All these people have this myriad of people coming into their home, and they all have something to do. They all have an agenda. Somebody has to take their blood pressure, somebody else comes in to evaluate the safety of their home. The chaplain even has an agenda. Those nurses that come in would love to spend more time with those patients, but they can't. They probably have 8 more they have to see that day. And so they have to leave this poor person that is longing for friendship and conversation and love. the volunteer is the only one that comes in there that doesn't have an agenda. He or she is just there to be with that person. Okay, I'm on a mission now. I really want to learn all I can about care of the dying. And at that time, people weren't even saying the word death out loud. And I'm trying to find a graduate program in care of the dying. And I never found it. So I fortunately found St. Mary's Graduate Center, which let me design my own program. And I designed my own program in care of the dying in their human development program. And it was probably the best opportunity of my life, because everything I did was, pretty much everything I did was experiential. I volunteered in every hospice program in the Twin Cities, nursing homes, hospitals, Our Lady of Good Counsel. I facilitated in grief groups, professional organizations dealing with death and dying. It goes on and on. I was hungry, truly, and would network with anybody who would let me see what they were doing or learn. And I was thinking today, as I thought about this, how helpful people were. Nobody ever said, oh, I don't want to do that. I'm busy. I don't have time to help you now. I don't think anybody said no to me about letting me follow them around or learn from them, which is a good lesson for all of us about you never know when you're going to be helping somebody or inspire somebody. But as part of that program in St. Mary's, my advisor called me one day and she said, gosh, I was just reading in the wall, and I think you should apply for that. And of course I received a letter very quickly saying they never have taken a volunteer and they didn't plan to. This was all for professionals in the hospice movement, medical directors, social workers, nurses. And she said, just don't worry about that. Keep applying it. The process will be good for you, and there's next year or the year after. Well, in my tenacity, I kept applying, and I'm sure that they finally decided, let's get rid of her, tell her she can come. And you know, I went out to my mailbox one day, and I'm walking down my driveway. I knew there was going to be a letter in that mailbox that day, and it was going to say that you are accepted. And I opened that mailbox that day. I'm not making this up, and the letter was in there, and they said I could come. And the next thing I did, truthfully, was sat on my curb in the street and bawled my eyes out. I thought, I've never been out of Fridley without my husband, and now I'm going to England by myself for 3 weeks. But it felt so right. I knew it was the right thing to do. I had no fears whatsoever. Went for 3 weeks. I was the only volunteer there, the only American there. Hospice was just beginning in the United States then. This was a pretty new thing. All the founders and professionals in care of the dying around the world were there. I got to listen to all of them speak. We even did experiential projects where they sent you to different hospitals and nursing homes and so forth in Great Britain. All of these professionals were in hospitals learning about hospice and institutions, and unlucky me had to go into people's homes and all these darling little villages in England with the medical directors who were caring for people in their home. I mean, I just felt I was the luckiest one there. It was wonderful. The best part of that was one of the speakers who was there was the founder of the home care hospice movement in the world. Her name was Prue Clench. They all spoke. It was wonderful, but something, the way she spoke, just really spoke to me personally. And I got back home, and I wrote a letter to her and just said, you know, I really want to follow you around, somehow learn from the people in England about care of the dying, because you're so far ahead of us. Is there any possibility I could work something out? I did not know that she had a special home next to her own home for people who came from around the world to learn about hospice. And the name of that little home was Tamarisk. And I was there, I don't really remember, I think it was a couple months. And I am not kidding you, she had an itinerary for me that when I enrolled it, it went to the ground. Every day I was on a train going somewhere else, to a residential hospice, a hospice facility. I loved it. I was just on fire to glean whatever I could to bring home and do this in my own community. My mission, I could see it unfolding. I wanted a residential hospice in this area like they had in every single little village in Great Britain. It was like driving down the street, you couldn't tell that they were hospice facilities. They were just darling homes where they cared for 6 to 10 people in these facilities with such compassionate care. And that was my original mission. I wanted to glean all of this information to come back here and found a residential facility in my neighborhood. I truly believe that people who are dying have very special and unique needs, and they're not met in a hospital or a nursing home. They're not designed to care for the dying. They're designed to cure and rehabilitate. So where were people going to get this special care that they needed? Where was the environment going to be for them to do this work? They're working hard to find meaning and purpose in their lives. I finished my degree. I'd gone back and forth to England then many times. And I'm telling you this because many of you are new, you don't know the history. Tamarisk was known worldwide, and I'm not exaggerating. I went to all these international conferences, and people wanted to know how they could do this in there. I'm a little bit ahead of myself. But I do want you to know that this is, I believe, a very precious organization, and I want you to value it as much as I do. The concept is unique in so many ways. It's out of the realm of the medical model purposefully, because as I listened to these people, and I had all these wonderful experiences and opportunities, but I need you to know that my greatest learning always came from my patients and my families that I worked with. They were always my greatest teachers. They still are. I'm working with a family right now, and they always teach me something new, always. They'd all been told too many times, we can't help you. We'd love to help you, but you can't. You don't fit our criteria. This was probably my biggest focus as I went forward to make sure this didn't happen within our organization. I got ahead of myself here, but I remember distinctly saying to my husband one night, what can I do? I know I have this dream, and I have this knowledge and the desire, but I don't know what to do with it. And I remember he said, everything starts with a dream. Now you have to find the people to help support it and make it happen. So whenever I was never home again after that, I always reminded him it was his fault that he got me going. But Tamarisk really has a sound foundation, and that is not to my credit. I wanted to get out the door and help these people. My husband was the one that was pulling me back in and reminding me that I needed to, silly things like a business plan and goals and objectives. And I credit him greatly with that, because I realize now how important that was in the time and effort that people put into the mission statements and the business plans. I did, at that time, I knew I was not the person to do the administrative part of building an organization. The hospice part I loved, and I felt comfortable and confident. But I had someone else who set up the education program for the International Schools of Minnesota came with me, a childhood friend actually. And she did that part of setting up the organization, getting the nonprofit status and all the things that I didn't want to do or couldn't have done. So we were a good team in working together to put this together. And I believe that we had a solid foundation. Our first board, the makeup of that board was so different because I had different objectives. I had to prove to my community that I knew what I was doing. Well, they didn't know me. I needed to get people from my community that were well known in the community. One was the administrator of Unity Hospital, lawyer, we had a prominent lawyer, people that I felt, you might say, well, how do I know? I don't know anything about her. Well, if he's somehow associated with it, there must be, I can do that. And then our board changed and changed and changed as for different reasons as it went on, but those, I'm proud of the strong beginnings of the organization to make it where it is today. The first office we had actually was in my bedroom. And I think what finally moved us was the first donation we got, and I remember how scary that was. It was a man that I had been volunteering with from my church, who was a builder in the area. And he listened to my dream, and when he died, his memorials donations went to Tamarisk, and that was $3,000, and for us who had nothing, that was huge. But I remember how scary that was, because now people were giving their money, and they were believing in what we were doing, and they were trusting us. And I was paranoid that we were going to let somebody down, and we actually had to get a bank account and a checkbook, and those were big steps then. I felt now that I did have my foot in the door. We moved from my bedroom to the Brickner, Tom Brickner, who was the first one to donate his memorials to Tamarisk. They also had office space next to Miller Funeral Chapel on Highway 65 by St. Philip's Lutheran Church. And they gave us office space there rent-free for several years. And I'm still on a mission for this facility. That was our beginning plan, to build this facility. But as time went on and we're learning more and more, it became clear to me that this was going to take a long time. It's a lot more money than I initially thought. The hardest part for me was all the restrictions and regulations by the federal government, the state government, all the medical things that this is not going to happen as fast as I want. People are dying. They can't wait for us to build this facility. During the time I was working on my master's degree, I was also working as a volunteer coordinator for Alina Hospice. They were helpful on them too. And I thought, well, maybe I could put a training program together and we could train volunteers to go into people's houses. Hence the beginning. I went back to St. Mary's Graduate Center and asked the gal who edited my thesis from there, who liked the idea of presence as she worked with me on my paper, if she would help put together a training program. That was her expertise, and she at St. Mary's. So she came, charged nothing, and put together a training program that I think no one else could beat. It was just awesome. And we had over 40 hours of training that they had to put in. And I still believe strongly in that. And I know everything has changed about training. But we were very, very stringent about who we recruited in our selection. That first group of people, there were 8 volunteers in that group, and I'm telling you, nobody was stayed safe on the streets of Ridley because I handpicked those volunteers. I knew, and I still believe today, you can get one volunteer that can ruin everything. I do believe that we put in all that time with training. We did a lot of self-help kinds of work in our training, journaling, working with, getting to know ourselves, because a lot of volunteers come to Tamarisk because they're grieving themselves. They're hurt. They've had terrific losses. You don't want them working with patients until they're done with their own stuff that can flow over to a patient. I think that's very important in recruiting of your volunteers. Anyway, that first class, we still have one volunteer from that class who's a Tamarisk volunteer. Let's see. Okay, and yeah, I love to tell that story because in that first class there was only one person that I didn't recruit myself. Her pastor from her church wanted her in. And I remember saying to my husband that there's only one person in that class that's not going to stay with us. And that turned out to be Diane Refshaw, who was just my other half for years at Tamarisk. So that doesn't speak well of my judgment of character. We eventually moved again to Time to Travel in Fridley office. They gave us we needed more space. We were there for quite a while, and we continued to train groups because after that first group went into homes, we could see the value of what we were doing, that people really did want to stay in their homes as long as they could, and we were offering that piece. And it was clearly visible right away that this was a good thing for us to be doing. We were still trying to raise money for the facility. That was still in the background. But while we were raising money for the facility, we were actually helping people. And I think we were training maybe 3 times a year at that time, 12 to 15 volunteers at a time. We put a ton of time into how we recruited and retention of volunteers. We even had people pay for training who weren't going to be Tamarisk volunteers, but they'd heard about our training, they wanted to be a part of it for the work they were doing, and it was even a moneymaker for a while. We gave some thought to selling our training program as a fundraiser, but we just didn't have enough hands to go around to do it, but I still think it would have been a good idea. Eventually we gave up on the idea of the facility, totally. And I never ever thought it was something that we didn't need, but it wasn't gonna be us probably that was gonna do it. A lot of the hospitals now are doing residential facilities, these beautiful ones. My own feeling was, when we had one, I wanted it to be free of charge like Our Lady of Good Counsel was. And I was just becoming more idealistic than, and I still would love to see it happen. And it might, I don't know. But earlier I said that I felt that the dying had very special needs and they needed an environment for this work to be done. So by not having a facility, am I saying they don't need that anymore? Instead, what I've learned, and I think this is what God was trying to tell me all the time, because the minute I got the facility out of my head, things started to flow again. I was a slow learner. I believe the volunteers are that environment. It's not about a building. It's about the care and the love that they're getting, and that's what the volunteers give. It's not about a physical building. The volunteers become the environment when they go in to work with the family. It was a hard lesson for me to learn, but I believe it with all of my heart now. The very first class of volunteers we had, 2 people, one being the lady who made this generous donation. She and another volunteer went in to help a family at night. This woman had her days and nights mixed up. And they would sit there at night so the caregiver could sleep. And he used to he'd tell that laughingly, he'd have to go in and tell them to settle down because they were having too much fun and he couldn't sleep in there. And when I was listening to Jean tell today about the family said they didn't really need us, they were doing fine on their own, it reminded me of this, because someone that I knew said this fellow's wife had cancer and he needed help, and that she'd like it if I would call him. So I called him and he said, no, I don't need help, I'm fine. And he was adamant about that. He did not need help. He didn't want anybody in there. And I understood that, but there's a huge piece here that I think is important and a good lesson. This is huge about building trust. It's hard for people to open their doors. As much as they know they need help and they need a volunteer, they don't know you. They don't know the volunteer. Some people are so desperate they don't have time to worry about trust. But there are a lot of people who worry greatly about this stranger coming into their homes. Probably even more so today than they used to. But I kept calling Wally and saying, I know you don't need help, but I just want you to know I'm here. I sent him notes. I kept in very close contact with him, and others the same way. And I'll never forget, it was on a Friday night, and he called me crying and saying, I just can't do this anymore. I need help. And to me, that's the lesson of building trust. These notes, these cards, these phone calls had told him, had built that trust with him. So when he really couldn't do it anymore and he really needed the trust, or the help, he had a place to go to trust. And I had volunteers there, I think within 24 hours. And I'm telling this story because Wally, after his wife died, came into Tamarisk, became our administrative person for several years. He had worked at Honeywell, he knew what he was doing, and it was awesome. Free of charge, no one ever received any money at that time. He also made it possible for us to buy, I have a picture, the Fridley Journal is there with it. We purchased a house in Fridley called the Tamarisk House, and it was wonderful. It really made my dream come true because it had been in a historical list of homes. It was an old home, it looked cozy, it said warmth, it was inviting. We had volunteers from all over the Fridley area that came in and helped. This place used to be a gift shop, and it was peppered with nail holes from things hanging on the walls. People volunteered from the community in every aspect. Painting, filling nail holes, cleaning. We had one organization that made a volunteer ramp for us, or a wheelchair ramp. It was a wonderful place that gave us visibility in the community. There was a big sign out in front that said Tamarisk. My original dream too was that this would always be community-based, that the community would support it and take pride in it and be active in it. And we got there, and the house helped that because of, the visibility. We did our training, all of our training there. You know what, and that reminds me something you might think about that we did in the early days before we had a house. We'd use different churches each time for our training. And that gave the people in the church learned about what Tamarisk was. It got their volunteers involved, or their people involved to be volunteers. We even had 2 pastors that went through our training because they'd heard it was good, but more importantly, they wanted to know what their parishioners were doing when they volunteered, so they could support them. I've always thought that was very impressive. I always wanted it to stay small because of what I told you earlier about people wanting that personal touch that they were missing. I was afraid if we got big and corporate, we were going to be just like the rest of them. I was very careful about who I accepted money from as desperately as I needed it. Too much of it came with strings attached. You know, you have to get this information from them, or you can't do this, or you can only help this one. I didn't want any of that. I wanted to help the people that needed help and not have them fall between the cracks with us as well. And I think that's the greatest thing that's come out of Tamarisk that I did not intend. That really Tamarisk does help the people that fall between the cracks. That a lot of people that can't get help. I think the biggest piece of that is nobody believes more in hospice or supports it more than I do. This organization is based on a philosophy of hospice. But hospice pretty much says that a person can get help when the doctor says they have 6 months or less to live. And we have had people that we have helped for years, and they've needed every day of it. Lou Gehrig's disease, you go on and on and on. And we've provided tremendous help to those families. What have I missed here? Tamarisk had a wonderful, I think it had a wonderful foundation. It's based on solid principles. We had a financially solid organization with a firm foundation. We trained and retained a large contingent of competent, dedicated, committed volunteers. We were supported in the community. And you know, when I started out with this, the healthcare professions did not like me at all. I think they thought somehow I never got it, how we were going to compete with them. I mean, this little organization offering services free of charge. I remember going to the president of Alina and telling him this is what I was trying to do and wanted him to be aware of it. And they weren't all very happy. I was not well loved, and that was hard to take. But you know what? It came full circle, and they became our great supporters. We were helping them. You know, we were putting volunteers in with their families, and we got great support from those networks. But it wasn't easy. Kathy can attest to that. I mean, I gave my life to that, and that's not it's about being in people's faces, literally, just networking constantly. I think the networking part is huge. Tamarisk has always been in my heart and soul about taking somebody else's heart and hand in their hellish darkness when they feel alone and afraid, and they feel uncared for and unloved. And our volunteers make those people feel cared for and affirmed and loved. Tamarisk at one time became truly a golden child of Anoka County. It really was. But it was during that time that when I got a nudging in the beginning to start the organization, I also got a nudging that it was time for me to back away. And this was like one of my children. It broke my heart, but I knew then and I know now it was the right thing to do. New people like you come in with new ideas. New people bring new contacts. New is good. People were calling it Gretchen's hospice. That was not good. It needed to move on and take a life without me, and that was the only way it was going to survive. I know that. And it's no secret to anybody that there were lots of struggles and ups and downs during that time. But you know, that's what happens to people. We all struggle. None of us get through this without any hardship. Tamarisk has, and I probably don't even know all of it, but I listen to what you're doing here and what's happening. I've never felt as good about Tamarisk as I do right now, and I mean that from the bottom of my heart. I do have just a couple things I feel strongly about, and then I promise I won't ever say anything again. But I do hope and pray that whatever you do as you move forward with this organization, that you are cognizant and remember the things that were in the hearts and minds of the founders in the very beginning. One being that your first priority always is that your patients and your families feel cared for and loved, valued and affirmed because of this work, that remains your highest priority. And that happens by making sure that your volunteers are being trained in the concept of spirituality of presence, so they're comfortable, confident, and purposeful as they deal with their patients. And I also believe that you need to give that same loving care, value, and affirmation to each and every one of the volunteers. They are doing important work. They need somebody to affirm them and they're going to tell you they don't need it. They say it all the time. They love what they're doing. They don't need anything more. They do need it. Without a solid, dedicated, committed, large cadre of volunteers, you will have nothing. And without a passionate, supportive, large network of contacts and community, you will have nothing. However, this organization was formed on the premise that if we do God's work God's way, He will provide. And if you do this, you will have everything. I believe that from the very bottom of my heart. It was proven over and over. Because I need you to know, I did not know what I was doing. I could never have done it on my own. I just can't tell you how pleased I am with what I hear going on. You're doing great. And you need somebody to affirm you and value you, and I do. Thank you. And I wish you the best as you go through training, and I hope you can find as much fulfillment in it. You will be surprised. Every volunteer says they came to do this because they thought they were helping other people. And you know too, Christy, it works the other way around. You're the one that gets fulfilled.
Well, thank you, Mom.